When I was on the hormones and specifically the blocker, I was having terrible muscle spasms, muscle atrophy, and she had mentioned I had started peeing blood. I did start peeing blood for that time. I was developing spontaneous ulcers in my bladder, with no pathology present, so they didn't know why they were forming. I had also started having issues with sexual dysfunction at the time, like um, many intimate dysfunctions, breast pain and fluid leakage. I used to leak so much fluid that I would have like circles on the outside of my shirts. None of this was addressed by the doctors at U of M. Whenever I bring it up to them, they'd be like, that's just a normal part of womanhood. Um, so I never got addressed at U of M. I had a surgery done at Corewell for the biopsy and that ulcer in my bladder. And around that time, mom had gotten so freaked out about this stuff that she did fight to get my blocker taken out. And I would say
About 8 months, it took
about,
me.
yeah, a few months after it was taken out, though, I stopped having the ulcer.
Today is going to be a heavy one. I hope I don't cry. I already feel like crying. So with that, I want to say that these kinds of conversations are very important to me. And I sure hope they're important to you. And I believe we are all being gaslit into believing children are trans. And we are not hearing the voices of these young people louder and more prominent within the discussion of transgender health care. And these are the most important people in this fight to be authentic. And the gaslighting within the trans community has to be stopped, because no child is trans, no child is transsexual, no child is dealing with gender dysphoria. I'm going to tell you, as somebody who was a child who was very masculine and really was drawn towards more masculine things, I do not believe I had gender dysphoria. I believe I was just a kid seeing things in a different way than the majority of the other girls did. But it's not about me so much as it's about these young people being sucked into this horrifying medical experiment. And when I hear people say trans healthcare is not experimental, I just want to puke. So today I'm going to highlight this young man, because I don't highlight enough young men who are detransitioners or who have been caught up in this horrifying charade of healthcare. And so this young man's name is Jonni, and he is so brave, but at the same time, it's such a sad, horrifying story that I just can't even believe it's not bigger and it's not on every single news station out there. But again, of course it's not, because they don't want you to see this kind of stuff. And they don't want to see, the percentage, or they want to say stuff like the percentage of detrans is very small. No, it is not. Number one. Number two, even if it is small, one child hurt by this insanity and these crazy Frankenstein weirdo doctors needs to be exposed. And I'm just mind blown that this is, like, I'm a bad person for even talking about this within the transgender community. It's why I want to keep reminding you that I do not belong to any community, but mostly I do not belong to the trans community, okay? I'm not here to represent trans people. I'm here to represent me and my story and what I believe is the right, ethical, moral thing to do, okay? So I want to put that for all you weird hater freaks who think I'm transphobic. You just keep spewing, because I'm going to expose this if it takes my last breath, okay? Because if I save one kid from this insanity, I can tap out, but I'm going to save more. I swear to God, I'm just not going to be a part of this. So with that, let me finish up. First off, really, thank you so much for hitting that subscribe button. Thank you. I totally appreciate it so much. And it helps me bring these videos to you. And it really helps to get, but I'll still do it. Even if you don't, I'll still do it. But I feel so teary-eyed right now, because I just can't even believe that we're talking about this and people think this is healthcare. So with that, yes, thank you for that. Thank you for liking, and thank you for commenting. The comments are really important to this video. Okay. So here, let me finish this last this first video.
Fight to get my blocker taken out. And I would say
About 8 months.
about a few months after it was taken out, though, I stopped having the ulcers in my bladder, but I've had urinary incontinence ever since, constantly through the day. I essentially am like a faucet that won't turn off.
Still.
I still have fluid leakage that comes from my chest and pain in my breasts, as well as bone issues. I have bone that's growing in my joints. And my current doctors don't understand why. They're seeing these bony protrusions form over the past year and a half since I stopped hormones, but they aren't sure as to why this is happening to me yet.
So how in the hell are you doing this to children? This kid was put on puberty blockers at the age of 13. His story is insane. So I found him on X, okay, through a bunch of doctors and people I follow. Ethan Haim, the doctor who testified and, totally, completely blew up this story, and they came after him, and he's also a hero. And Brad Paquette. So I found all this because I was I just am so obsessed with getting these detransition stories out there. So these clips I'm showing you are from a Michigan hearing. Hopefully the Department of Justice sees these. And Brad Paquette, who is a educator and also a state representative for the 37th District of Michigan. And it's a very profound interview he did with this young man named Jonni. And Jonni, which I'll put the link to his ex, is 23-year-old detransitioner, former trans kid on a mission of justice and understanding. Bullying is not cute. Mutual understanding is. He's such a sweetheart kid, and I'm gonna hopefully get an interview with him. But with that, so let me bring up this next piece.
The reasonings to be put on puberty blocking drugs and cross-sex hormones was a specific endocrine disorder and ICD code that the doctor put in, and I saw it was used about 111 times in the records of 600 pages. And this endocrine disorder related to puberty, Jonni, did he have this endocrine disorder? I'm reading, what this is specified for. It's for things like androgen insensitivity syndrome, carcinoid syndrome, ectopic hormone secretion. Did he have any of those ailments?
No.
No, I did not. And if I may comment on that real fast, I did not realize that I was diagnosed with an endocrine disorder related to puberty. He never discussed what he was putting in my records. So we were not informed as to those diagnoses until much later when we pursued my medical records after I quit hormones.
My understanding is that's very clear insurance fraud.
So really, if this is an actual thing, right? Let's just say this is an actual thing here happening. Why do you have to do insurance fraud? Why do you have to lie about somebody being transsexual or transgender? And why do you have to put something else when that's insurance fraud? To say that you have a tall stature. So what they were trying to do was say he was a she, okay, at 13, and this crazy Dr. Schumer, who I'll show you who is, he basically was lying to the insurance company saying that this is a girl who's going to grow too tall, and so they need to give her puberty blockers instead of saying this is a transgender boy to a girl and we need to give her puberty blockers because it's not legal to give puberty blockers. So they had to lie about it, and this is what I'm talking about. They are using these kids for experiments. Because if it was on the up and up, they wouldn't have to lie to the insurance company about why they're giving puberty blockers to a 13-year-old little boy and telling him that he's really a girl and not a boy because he was very effeminate. I'm going to put a link to his whole interview, but he grew up very effeminate and I think possibly feeling like he could be gay. And so he also, I think his faith kind of pushed against that. And so everyone was telling him, especially these doctors at the Gender Center and the University of I think it's the University of Michigan, were telling him he'll be better off living as a girl instead of a gay boy That's what we're all trying to tell you. This is also a homophobic attack on kids, on gayness, on homosexuality, all of it. It's actually so profound, seriously. So there's that, right? Now it's insurance fraud. Oh, this part of the whole interview. Okay.
Lastly, I noted that you were sent, when you were 13, you and your mother, Melissa, were sent to a sex shop. Could you fill
I'd
in
like
on
to
that?
speak on that.
Yeah.
What?
Could you fill in on that briefly?
So Sarah Weiner and Dr. Schumer, on the first visit when they were together, decided that because I'm unsure about all this, Johnny needed form fitting to feel feminine. When I pull in, it is a purple building. And so for me, I'm thinking, this is not where I'm supposed to be, right? Something's wrong with my GPS. So I sit there and I Google it. Nope, I'm at the right place. And this is the name of the place. And it was a lot of wigs and 6-inch shoes with the big platforms and feathery stuff and stuff like that. But I can see on the wall around the corner, there were things that reminded me of what would be like a lion's den. So we go in, and now it's sex toys and stuff for around the corner.
Wow.
In lit up displays on both sides.
What?
And get around the corner. And then there were form fitting stuff with like fleshy, like rubber, right?
Cyber skin.
Why were they sending this young kid and the mother to this Janet's closet to get clothes? That's just so twisted and crazy. No wonder people, like, what is happening? Who is sending this young man there to get these kinds of clothes? This is a cross-dressing store, by the way. This is for cross-dressers. This is not a store for transgender people. This is for men who have a fetish to dress as women. So, wow, the whole thing is so twisted, you guys, and so pathetic and disgusting. So now I really want to bring you this because this is the beginning of this really great interview that I found that I will put the link to. This was at the Gen Spec conference in New Mexico, I think it was last month. So Brad sat down with this young man. Here, let me just find this marker here.
When you were 13, you got signed into U of M, right?
Yeah,
Moms.
that's where we got the referral from.
Got the referral.
Because she was seeing the doctor that I would later go on to see.
Gotcha. And so the doctor was Dr. Schumer. Mm-hmm. And I guess give the lowdown on what the beginnings of that looked like when you were 13.
So it was in May of 2016 when I was 13 that I went to see the gender therapist first, because that's supposedly standard protocol before you see an endocrinologist. And I had a 3-hour consultation, just me and her, and we had talked about all the things that I was insecure about. My religious beliefs was a very big theme, and you can see this reflected in my medical records a little bit. I was very, very devout, and I legitimately believed that, I was growing into something that was really sinful and undesirable to be as a human being. And I was developing the thought process that, well, if I transitioned to be a woman, then I'd be a straight woman. And she really hammered that in. She brought up, with my personality, I might not be actually accepted into the gay world anyways, because gay men usually want men. And, she affirmed that I had a feminine personality and that this might be a better route for me to live a normal life.
Wow.
Live an acceptable life.
See?
And that really, hearing that from a mental health professional that you're confiding in just really made me feel like, well, then this must be objective truth, And she had called my mom in after that and gave the usual, well, you have a daughter now, congratulations, do you want a dead son or a living daughter?
And that was specifically mentioned to your mom?
Yes, specifically. And like I said yesterday, you can talk to my mom at any point as well, and she will give her side of the story with that, because when this gender therapist was meeting with my mom, I was not in the room, and she was meeting with me, my mom was not in the room.
You know, you see what they did there? They manipulated. They also manipulated the mother into believing her son was a girl. That's what I keep saying. These healthcare professionals have also been a part of this whole indoctrination thing. Now they're like affirming, why would you want to be? The therapist literally did conversion therapy on this young man and said, well, why would you want to be gay? You're not going to have a good life being gay. You might as well just be a woman. That's conversion therapy. What is happening? So which one is conversion therapy? Converting a transgender person to be a girl, to be a male or female, or to convert a gay person into being trans? Which one is? Because you see what I'm trying to say here? The trans community has hijacked the term, right? Conversion therapy. Because if you're actually, you don't need to be talked into it if you're trans. Okay, so they're literally twisting this young 13-year-old boy's mind around who and what he is, and that he shouldn't be a boy, he should be a girl when he doesn't feel like a girl. But they're telling him that you're going to be better off living that way because it's not cool or not good to be an effeminate male. It's all right there. So let me find this other piece. Hold on one second. There's so much good stuff in this interview, you guys. It's crazy. He spills the beans on it all.
And I'm just trying to bring awareness to the people who are being harmed. And not just the people who are being harmed, but the children being harmed. You know?
And there are a lot of them, unfortunately. Your story is not an isolated case. I know that for a fact.
And if I may give advice to other policymakers that might have had a vested interest or might have stuck up for this practice in the past, would be to, if you really care about any group of persons, it would be in your best interest to lay down the burden and acknowledge that there are children being harmed in this. You don't want to continue to defend something and it come out that so many people have been destroyed by this. Like my friend Haley, she passed away, from heart failure at 24. People are being seriously harmed by this. And people who are, grow up to not be trans, like myself, or people who even do, like my friend I told you about yesterday, who her surgery went wrong and she can't even get in touch with her doctors. These people are committing serious, it's so beyond malpractice. It's serious fraud and
That's right. It's fraud. This is fraud. He's saying it right there. This is somebody who has actual experience from the age of 13, I think, to the age of 23 or 10 years or so of the insanity that went to his body. His body broke down. I think I opened with that first clip. It gets even worse. He was dealing with so much, and the doctor blamed him. The doctor blamed him for making the choice at 13. This is what I'm trying to tell you all. If you actually think a 13-year-old is trans and can make that, you're not listening here. And there's no way you've been around kids or you understand kids. No child can make a life-changing choice and add drugs to their body that these people have no idea what the long-term effects, except for when you see a person who of 13 years to 23 and the amount of damage it has done to this young kid's body, and you're all acting like, oh, well, it's only one kid. What if it is only one kid? What if? But it's not only one kid. Because what about the kids behind this person who are going to come up next and then be the generation of kids in so much pain? I am just so fucking pissed that we are all screaming and no one's hearing us. It is the most, what happened to our society? What happened to us that we are willing to turn our heads on children and say, no, doctors know what they're talking about. Doctors don't know what they're talking about. They practice medicine, and many of them have fucking egos. So this little motherfucking doctor, his name is Dr. Schumer. Dr. Schumer is a proponent of transgender surgeries for minors and the associate professor of pediatrics at the University of Michigan. Okay, so he testifies all the time in favor of transitioning children, yet this is what happens to his patients. What? So he's like a authority for trans kids. He gets asked all the time to come in and speak for kids. So one of the things he said, attempts to cure, in quotes, transgender individuals by forcing their gender identity into alignment with their birth sex are harmful and ineffective. What? You literally did the opposite and you harmed a kid and it's ineffective. So no, you are actually wrong. Okay. Those practices have been widely denounced. Not true in any way, shape, or form, as unethical. This guy is insane. By all mate. Okay. This is the key right here. Those practices have been widely denounced as unethical by all major professional associations of medical and mental health professionals, such as the American Medical Association, the American Academy of Pediatrics, the American Psychiatric Association, and the American Psychological Association, amongst others. Right there. Every single one of those organizations needs to be held responsible for this because they are advocating for the unethical use of medicines and surgeries on minors. What? How is that even possible? Are you actually going to be okay with these organizations? Every single one of them needs to be disbanded because they're lying. They're actually lying. And it's why I'm trying to tell you, the medical world, okay, is insane. They're just about creating patients. They don't want to cure you. And also, when you put cure in quotes, the last thing I wish I ever had to do was this, okay? I wish I could have been cured of having to take this route, but I did. It kind of worked out for me. It's all good. I'm not complaining. I'm moving forward. But why would I ever want a child to be put in this position is beyond me. Why any adult would ever want a child. Oh, I'm just going off. I apologize. I just can't. I just can't even stand that these are our medical professionals pushing for this shit. Okay, so this is Leo. I think I pronounced his name Sapir. And he's a senior fellow at the Manhattan Institute, a PhD, Boston College. We follow each other. He's great. He talks a lot about gender medicine, and he knows a lot. And he's very, 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 very versed in what he says. So listen to what he's saying. This is a Gen Spec conference.
So now let me turn to the Endocrine Society. In 2017, the Endocrine Society published a clinical practice guideline on gender medicine. Despite acknowledging the poor quality of evidence, the guideline makes strong recommendations in favor of puberty blockers and cross-sex hormones, a move that has drawn criticism from some of the world's leading experts in evidence-based medicine. The Endocrine Society explained its decision by invoking the, quote, values and preferences, unquote, of pediatric patients wanting endocrine treatments. It said that it places a higher value on, quote, avoiding an unsatisfactory physical outcome when secondary sex characteristics have become manifest and irreversible, unquote, than on, quote, avoiding potential harm from early pubertal suppression. In other words, according to the Endocrine Society, helping a teenager achieve his or her cosmetic goals is more important than preventing harms from the use of off-label drugs.
Wow.
It's important to note that the clinicians who wrote the Endocrine Society's guidelines are themselves gender clinicians with conflicts of interest, and most were WPATH members. Oh. Now, a key element of WPATH strategy has been what I've called credibility laundering. Medical associations with broader scope and larger memberships have specialized subcommittees dealing with LGBTQ issues, which today means primarily gender medicine. That's right. And these groups are WPATH aligned or even affiliated. For example, Dr. Erin Jansen of Lurie Children's Hospital is co-chair of the American Academy of Child and Adolescent Psychiatry's Sexual Orientation and Gender Identity Issues Committee. Incidentally, he's also a WPATH member and co-author of WPATH's 8th Standard of Care.
This is, the LGBT coalition, they're great too. I support them a lot. But you see what's happening here? It's all a scam. It's all a scam. They literally all are on the board of all the there's nobody that has an opposing opinion. Why aren't I on the board of WPATH? I'm an elder of the transsexual community. Why don't you have people like me on the board? You only have people who are yes men. Yes men in the medical space, yes men in the psychological space, yes men in the pharmaceutical space. Yes, 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 yes. Yet we can completely keep showing you it's about cosmetic It's about the cosmetic outcome of this youth. Do you understand what I'm trying to say here? It's not about the mental outcome. It's the cosmetic outcome. They don't want these kids to grow up, let's say with Jonni, to grow up looking like an effeminate boy. So they're going to change him into a girl so that somehow they think that's going to make him walk the world better. But his mind has not been changed. Only his physical features. So they're forcing this person who is a biological male to become a female without doing any work on the brain and understanding that it is 100% perfectly okay for an effeminate looking male to walk the world. It is so twisted and so insane. It's experimental. It's experimental, which we've been doing these experiments on transgender sexual people not forever, 30, 40, 50, 60, maybe 60 years or something like that. You know, you have to really understand what it means is going on with these children. It's so sick. It's sick, sick, sick. If you know anyone who has a transgender kid, send this to them, okay? They might deny it. For some reason, they want to believe the doctor because, remember, do you want a live daughter or a dead son or whatever the fuck they're saying there? It's like, so you want a dead daughter or a live son? Like, what are you talking about? That is the most gaslighty, complete, manipulative bullshit.
Hi, hello, good morning. My name is Layla Jane. I'm a detransitioner. I'm someone who received gender-affirming care as a minor and later came to regret it. And I reverted back to my birth sex. I was prescribed Lupron and testosterone at 12, and I underwent a double mastectomy at the age of 13. I'm here in support of House Bill 1172 because it would ensure that people like me can access the medical and mental health care that we need in order to cope with the lasting effects of these treatments. Currently, there aren't even proper billing codes or protocols for detransitioners, which is a huge barrier in us even getting help. I shouldn't have to fight with my insurance to get physical therapy to cope with the joint pain linked to hormonal treatments I received, or for the psychiatric care I need for the PTSD and depression linked to medical interventions I received as a minor. I have severed ducts in my chest that would need to be surgically removed if I were to ever decide to have children. I didn't even know this could be a complication when the surgery was done at 13. I'm having to fight my current insurance to get supplemental estrogen covered, which would help with the atrophy and urinary issues I face from testosterone usage. Many pediatric transitioners, like myself, we reach this point in detransition right around age 18. At a time we're just starting out in life, often with little income and no health coverage beyond what's provided under our insurance. Most of us can't afford these treatments out of pocket. This bill would make a huge difference. It would give people like me a chance to heal and move on as healthy, functional adults. I urge you to vote yes on House Bill 1172. This should not be about politics. It should be about compassion, fairness, and making sure no one is left without care. Thank you.
You know what blows me away is that they're willing to put these young people through all this medical intervention or treatment or healthcare, but they're not willing to help them when they decide not to use this healthcare. Don't you find that quite interesting? Because you would think that they would want to help the kids, because isn't that what the medical space is about? Helping you get healthy and being a better person and moving forward in your life. But it's not. This proves to me that they don't care about this, because they're not even willing to work with the kids who are saying, I should have never been on this. In my opinion, it's because if they do that, they will be owning up to the fact that it doesn't work. So they cannot help these kids, because if they help these kids, they are stating that, yep, you're right, this medicine doesn't work. So that says to me, this is all a sham. It's a 100% medical scandal, because that is not medicine. You can't only do one side and not the other side. This is pretty mind-blowing, this one right here. This was on, I think, Joe Rogan, and it's Dr. This is Dr. Peta Attia tells a story about woke ideology in the medical school of urology, okay? It is actually mind-blowing what you're going to hear right here. Mind blowing.
My roommate from med school, who's a urologist, called me yesterday because he couldn't wait to tell me this ridiculous story. So a colleague of his, this female urologist who's badass surgeon, was giving a lecture to the medical school, which is common, right? You'll always have the surgeon will come in or the doctor will come in. And before she got up to give her lecture, the dean said to her, I'm not making this up, this is a urologist giving a lecture to a group of medical students, said, I would appreciate it if you would not use the word penis during this lecture.
He said it before the lecture?
Yeah. She said, it's an anatomic term. I'm a urologist. What would you like me to say? And what he came up with some idiotic, he said, maybe you could call it male erectile tissue. And she was like, well, she's now fucking with him. She's like, but
what if it's flaccid?
Wouldn't the use of male also be kind of triggering in that sense? I mean,
good point.
Yeah. I mean, and she basically told him to piss off.
And what did this guy was the dean?
The dean of the medical school.
And I assume he's a doctor as well?
He should be. Yeah. If he's the dean of a medical school, he would be an MD.
What in the fuck is wrong with people?
What is fuck wrong with people? What's wrong with people is they're captured and they're manipulating the system. How dare you say it shouldn't be called a penis? Like it's a penis. Like what? This is the manipulation going on within the whole medical transgender. They're trying to actually to rearrange what it is to be a man and a woman. 110% they're doing that. There's no doubt. We can prove it to you every single day. I'm going to leave you with this last thing. This is from Scotland.
224 years. That's how long somebody in Scotland can expect to wait before they get an appointment at Glasgow's Gender Identity Clinic. The wait across the rest of the UK is 25 years. None of these waiting times is acceptable. We need better trans healthcare right now. Trans people have always been with us, and it is only right that we deliver the healthcare that they need to be themselves.
So if you don't think that's cult-like, then you don't know what a cult is, because literally that's cult-like. The flag in the back, the way they're standing, look at the person's eyes, okay? And they're repeating the same mantra over and over. We need trans healthcare. You deserve trans healthcare. What is trans healthcare? That's trans healthcare. The whole video, what I showed you today, is fucking trans healthcare. It's disgusting. It's wrong. It's an experiment. It doesn't work. Okay. It's not healthcare. Okay. It's a treatment, which is different than a healthcare. It's a treatment that is experimental. That does not work. So thank God there's a 25-year and a 227. The gaslighting numbers too. Thank God that there's that much. We are going to save so many young people from making the fucking mistake. If you care about these children, and you actually do care about the fact that transsexual people exist and they do struggle with a form of mental disorder, and you want to see people live a happier life, you've got to help me get this message out there, because I can't even understand. My brain doesn't function in a way that says this is completely normal and this is completely okay. These are 13-year-old kids. My son is 13. I see him every day. And I often think, what if? What if he said, well, I feel like a girl. What if those things were there? And I was a parent who didn't understand what that meant. And I was a parent who was willing to listen to the doctor. And I was a parent willing to give my child irreversible medications and surgery. I think about that. And I'm not blaming parents. I'm not. But as a parent, and as a parent of a brand new baby girl, and as a transsexual, it breaks me. Not much breaks me, I'll tell you that. I'm pretty tough. But when it comes to kids, and if you're not crying, it doesn't have to be physically, but in your heart and in your soul, if you're not crying seeing these things happen to these kids, then you're not listening. But we have to come together and figure out why we have let the medical world do this to children, and why it's continually happening, and why we are being gaslit into believing this, and why penises can't be called penises and vaginas can't be called vaginas, and girls can't be girls and boys can't be boys, and there can't be effeminate boys and girls, and there can't be a full range of all kinds of people. You know, transgender medicine is a scam. It is 100% a scam. I am telling you, as a 33 plus transitioned female, I never changed my sex. I changed my appearance, but I was mentally strong enough to understand that and move forward in my life. And I believe I'm here today to tell you that my purpose is to make sure this doesn't happen to kids. Okay? So I really was going to try not to cry. I was, but what are you going to do? So with that, I hope you feel my heart. I hope you feel the pain this is causing these young kids. And I want you to know that it means a lot to me that you can hear me here. You can hear me and you can listen to me and you can want to help these young people move forward in a more healthier way in their lives. You are going to see why this should never be happening.
Hello. My name is Karen Selva. I use she and her pronouns. I'm a pediatric endocrinologist and the medical director of the Randall Children's Hospital T-Clinic. This clinic provides multidisciplinary care to transgender or gender-expansive youth and their families. Today, I would like to discuss the use of pubertal suppression or puberty blockers in transgender and gender-expansive youth. Puberty blockers work at the level of the pituitary gland, and they actually suppress the release of the LH and the FSH so that the sex organs are no longer stimulated.
Hi, welcome back to my channel. I'm on daddy duty these days. I might look a little exhausted. I signed up for it. But anyway, let's move forward. Oh my gosh, the stuff I just found is just incredible and crazy. And I just cannot believe we keep doing this to kids. So with that, I think I found some really great stuff to help all of you who are maybe on the fence or maybe don't think what we all keep telling you about puberty blockers isn't true. I think hopefully all of the things I'm going to stitch together for you today will put together a better, informative, factual story of why this should never be happening to kids. So with that, thanks so much for subscribing to the channel. Thanks so much for liking this video and the comments. I really do try to read all the comments. It's been a little bit crazy these last couple weeks, but I'll get back into the swing. So thanks for being patient with me as well. So with that, let's move forward in the rest of this video. And this lady is nuts. She called it the T clinic. These people, you see what they do? They use language to make it sort of like fun and happy. And you know, this is serious business. They're messing with children. Oh my God. I just can't. It's so upsetting.
It doesn't produce estrogen anymore, and the testicle doesn't produce testosterone. Thus, the signs that we see from these hormones are blocked and don't progress in puberty. What are the benefits of using puberty blockers? Well, the main benefit is that they prevent the unwanted and permanent effects of puberty, and thus future surgeries can be avoided as an adult. We can prevent the need for any chest reconstruction in affirmed trans males or facial feminization surgery in trans females.
See, I told you that's what they want to do. It's all about physical traits. They don't care about what's happening in the brain or other parts of the body. They literally just said to you, it's about making sure that you don't have to have surgery later on and that you won't be feminized as a trans man with boobs or masculinized as a trans woman, so you won't have to get facial feminization or other bullshit. Can you imagine that this is really the focus of these puberty blockers? Nothing else matters to these people.
They are also reversible, and thus if the patient decides to stop using pubertal blockers, their endogenous puberty will resume as previous. Using pubertal blockers can alleviate the depression or worsening gender dysphoria that is often associated with progressing pubertal changes. And lastly, the use of puberty suppression is recommended by the Pediatric Endocrine Society in their clinical guidelines for the treatment of transgender and gender diverse youth. What are the potential risks of puberty blockers? The practice of using puberty suppressors in transgender youth is new.
It's new. Pay attention here.
Since the first clinical guidelines were only published in 2009. Thus, we don't have long-term studies with long-term outcomes and data yet.
What? She just literally admitted they don't have long-term studies and they don't know, yet they're still going to tell you that it's reversible, yet she just admitted she doesn't know shit about shit. And there she is giving kids this shit. Like, what? This is so insane, and why we need to listen to these wingnut doctors who are experimenting on your kids, okay? No, there's no such thing as trans kids. Stop it already. So then I want to bring up this because it's so, wow, I just took a deep dive while I was babysitting. So I love the body language dude. So he looked at this video too, and this is what he said.
We are talking about crazy parents, soccer moms that are, have been way too much into alcohol or something like that. They want to know the social clout, and they want to chop their son's dicks and their daughter's tits. It's that simple. That's what they want to do, to be part of the transparent club. Oh, that sounds nice. Transparent club. I should copyright that. But then, no such thing as a transgender or gender expansive youth exists. That is nonsense. And these people are just reaffirming something that is just a mental illness from the parents, like transmitted from the parents into children, and thanks, of course, to teachers and doctors, quote unquote, like this.
Yes, exactly. Thank you. Body language, Dr. Jesus. Are you a doctor? I don't know. Maybe you're just a body language dude. I don't know, but you sound like a doctor. I guess anyone could be a doctor these days. It doesn't even matter anymore. It's so ridiculous. It's like, what is happening? I love what he said. I just had to slip that in there because it's like they just want to cut their little kids into it's crazy. These parents are crazy that they even think any of this kind of shit is real. So, as you know, we have detransitioners who were put on puberty blockers, and why this next person is so important in this conversation. They are somebody who actually took the puberty blockers, okay? You can't deny. But of course, the trans community tries to hide these voices. One thing I want to let you know is on TikTok, they're actually letting this conversation come back, which is actually pretty amazing. So listen to this, kiddo.
I know all of you take one hormone and then you become trans rights activists. I wanted to give myself time to really explore my feelings and detransition before I shared them with you. But if you want to see the truth, this is the truth. I'm an almost 30-year-old man. This is what I look like. This is what I sound like as an almost 30-year-old man. This is what happens when you let people transition in adolescence before they've had a chance to grow up. Before they had a chance to even learn who they were. Not just but pressure people to transition at these ages. Young, vulnerable people who are already so suggestible. And I feel like everyone is ignoring the pain because they are afraid that it threatens their choices and their narrative. If you want to transition in your 20s, you've had a chance to be a man or a woman, and this is what you want to do, okay, that's one thing. But the active pressuring of people to transition so they can preserve their femininity, which is what happened with me, I was told that that if I allowed myself to age, that I would become masculine and that it would never be possible and that I would do it anyway, and that I would be a more masculine transgender person like them.
Wow.
And so I made the choices that I thought were right for me at the time. I do take accountability. I did it in secret from my parents. I take accountability for all my choices. But when is the trans community going to take accountability for theirs? For leading me down this path? This is the face of an almost 30-year-old man. This is the voice of an almost 30-year-old man.
I just can't. That one just, my stomach hurts. That is what puberty blockers do. This is what they want for these young kids to not grow up. That just is the freakiest, weirdest thing ever, okay? Because how can this person right here who was put on the puberty blockers, they even said they did it behind their parents' back. I don't know how they did that. But are you listening to these people who took the actual puberty blockers and hate how they are now? How can you expect a child to understand the future when they don't even understand what they're living in at the moment? It is 100% child abuse. And the sicko trans community activists are pushing this nonsense. These wingnut wackadoodle doctors and surgeons and everybody calling it gender affirming care are out of their minds. And I truly cannot understand where they're coming from and why they think that this is helping any of this cause to help an adult live in a beautiful, amazing space that they chose for themselves and move forward in their lives to be healthy people. None of this is healthy. And most of the people who are exposing this don't have a problem with an adult transsexual. They don't. They'll always say, I don't care what an adult does. Go right ahead. They care about these kids being shoved into this horrifying space. That person's testimony right there is everything. Everything. This next one, it's going to blow your mind. It's going to blow your mind.
So there are 300,000 transgender youth as of 2022. That population has doubled since 2017. There are 17,000 minors on puberty blockers. And the increase in chest surgeries, mastectomies for minors was 389% between 2016 and 2019. So
the argument is it's nothing. It's nominal. It's such a small, who cares? Gavin Newsom has even said that himself. Why are we litigating this? Such a small amount of people. Like, first of all, any child that you're sterilizing, you're compromising the development of their brain, their bones, you're taking away sexual function for the rest of their lives.
Correct.
One kid's too many.
Too.
Right.
Incontinence.
No incontinence. That's a new one. Like, one kid is too many.
Yes.
But they're lying about the numbers. That's what's even crazier. It's such a small.
So
who
let me
cares?
give you
It's such a small number.
But
what do you mean?
yet,
who cares?
it's not a small industry. Okay. In 2022, the market size, okay, this includes the surgeries, revenue from the surgeries, and revenue from the hormone treatment was $4.1 billion. In 2018, that was in 2022. In 2018,
hold on. What? Here we go. The money. I wish I didn't even have to think that, but it has to be money. We all know what pharmaceutical companies, we know what corporations, it's all the bottom line. It's all about making money. They are using kids. I have the chills to make money. When you hear these stats, it is out of, and what he said before, the stats of how many young people, mostly girls all girls getting mastectomies. And then the rate, 17,000 children are on puberty blockers. There's hardly any of them. And they're not just giving them out like candy. These are facts, people. Well, here, now listen to the money.
it was $2.94 billion.
Oh my God.
And by 2030, it is expected to be $7.8 billion. That is a 8.4% compounded annual growth rate. That exceeds the healthcare industry, which is only growing at 5%. Now, here's something really shocking I found. Surgery revenue for transgender surgeries in 2022 was $2.5 billion. Okay. The total cosmetic surgery market in the United States for that year was 16 billion. So trans surgery represents 15% of the revenue for cosmetic surgery in the United States in 2022, despite the fact that trans population is 0.6% of the population.
Okay, I mean, that's it. Bam. Should we all just hello, shut it down? There it is. There it is, right there. Come on, you can't, this isn't a lie. This man did research. It's there. Someone finally took the time to actually do the research. I'm transsexual. I am not anti-transitioning. I am anti-transitioning young children, babies, kids, 7-year-olds, 10-year-olds. What do you people think you're doing? You're wingnuts to even touch a child in this way. You are the ones who are creating the way people will take all transgender, transsexual medicine off the table. This next one, another factual piece.
What are the consequences, the potential risks of starting to take puberty blockers at 11 years old?
So these are the same medications they use for advanced prostate cancer, Lupron, because it castrates the hormones from an individual's body. It shuts the whole system off. A lot of these older men can't tolerate it because they have such severe mental responses to it. They get depressed. They lose all of their energy. They go into menopause. They have hot flashes. They can only do it for a couple of months before they can't tolerate it. And they're doing this to kids who are 11 years old. It's more than that when you do it to a kid, because what happens is they essentially do not go through puberty. So number one, you will sterilize them because you don't undergo the exposure to the hormones that allow the maturation from immature sperm to mature sperm or immature eggs to mature eggs. If you never undergo that process, you never develop the cellular architecture necessary for fertilization. And then you can also develop in boys a permanent micropenis, like in the case of Jazz Jennings. Because his puberty was blocked, he never underwent the growth of his sexual organs. You have adult men who have permanently arrested sexual anatomy. The moment that's arrested is when they're 11 years old.
Dr. Ethan Heim, I think I pronounced his name. He actually is an amazing human and spoke out against this at the hospital, and they came after him, and he had a huge lawsuit, but he finally won. And this man is one of the soldiers and the warriors, and he will go down in history as doing something so amazing for the young people. He was a whistleblower, and he got so nailed by the trans activists, but he came back because people supported him. This is an actual doctor who was seeing it all going on in the hospitals. He's like, what? I don't understand medical people who are just letting this happen. I just don't understand, other than it has to be money or ego or both. I had a couple of other detransition ones I was going to show you. I'll show you this one.
Hi there. Today I'm going to be talking a little bit about my detransition. I have a question from a commenter. What got you to detransition? The main thing that got me to detransition was that I didn't like any of my masculine features. I like being feminine, and I like having feminine features. So for example, I don't like having excess body hair. I don't like having a deep voice. I don't like having a flat chest. But I do like being smooth. I would prefer to have a higher voice, and I would prefer to have boobs. That's not to say that if you're a trans man and you like feminine things, that doesn't mean that you're not trans. And the same goes for trans women who like being masculine. It doesn't mean that you're any less valid.
Well,
this is just my own personal journey and what I noticed for myself. So that's why I detransitioned.
So do you see the language there? That always, bless you, friend. I hope everything is going great with you. But you were duped into it again, okay? And so, but you see, they're still saying that language. It doesn't mean you're any less valid. Yeah, it does. It means you don't have gender dysphoria. Yeah, you're not trans. Just knock it off. Knock it off, people. We need to get back to facts. Okay, understand it's a very small population who are transsexuals who deal with gender dysphoria as they grow, and they can't grow out of it. Most people, as we know, grow out of it. Okay, now this young lady is stuck with everything she hated. Why was she not being told, you're going to grow hair, you're going to get a deep voice, you're going to look like a man, which is what you're supposed to want to do, but you actually hate it? Imagine if they put this kid on puberty blockers, okay? They would have never been able to come out of it because they would have been put on puberty blockers, which would have never enabled them to have any femininity or female characteristics. This person took testosterone as a young person, but they can come out of it because they went through puberty. This last one I want to show you because I put it here for a reason, because you're going to see a male to female who was put on puberty blockers, started to speak out against it, and the whole community came after him. And I want you to see, this is what these trans activists say when all of us start to talk about why puberty blockers are disgusting and has nothing to do with gender affirming care. So watch this.
Let's talk about Lupron, a commonly used puberty blocker that definitely can cause infertility. Anytime I have a debate about this subject, a peer-reviewed article gets brought up that says, oh, Lupron is usually completely reversible. See, when I got put on Lupron, the doctors gave me a sheet that looked like this. It says, many of the effects of hormone therapy are reversible if you stop taking them. The degree to which they can be reversed depends on how long you've been taking them.
Yes, just like with anything can have a regret rate. And it's pretty hypocritical of you to want to deny puberty blockers gender affirming care for trans kids, trans youth, when you got to have gender affirming care as a youth. That's pretty hypocritical. It's good for you, but it's not good for anyone else. No one else can have it because you had a regret. Because you can't, or possibly can't, be able to have a biological kid. Nobody should be able to have gender affirming care, especially trans children. But this puberty blocker that you're talking about isn't just used on trans people, as I'm sure you've heard, because there's a lot of people talking to you and stitching your videos and duetting. Cisgender children with precocious puberty are the ones that take these puberty blockers the most. So they don't have puberty. They aren't going through puberty at age 5 or 6 or 7. They get put on them until they're at a good age to start their puberty. So that's okay. It's okay for cis people to be on this drug because cis people know better. Cis people, the effects on them aren't as bad as if you're trans. Just automatically being trans makes it worse, makes the symptoms and the possible side effects worse because they're trans. Or we just want to limit trans healthcare and everyone else can still have their gender affirming everything, but trans people can't because we're not educated enough, we're not smart enough. Trans children are without any level of intellect. They are without understanding. Like, it's really annoying how many people think that trans kids are incapable of knowledge, incapable of understanding. That's really insulting. Like, I knew that I was going to go through a puberty. I didn't want to, and that it was going to ruin my life. And it did, and that I would have irreversible changes. But we don't care about that, right?
Okay, so the reason why I wanted to bring that one was because you see that? It's always those types of trans activists. First off, why are you sitting there in your underwear with those weirdo flags behind you? And you look like a psycho, okay? And who's going to take you seriously as you're talking about you wish when you were a child? That's you, okay? This person was actually on puberty blockers, not you. You can fantasize about your childhood all you want. It's a fantasy. This is a factual thing coming out of a person who was literally put on puberty blockers and wish they never were. Why are you people keep saying stuff like that? We can all wish. I wish I was born a dude, but I wasn't. It's not factual. I'm not a dude because I wasn't born that way, okay? So no one ever, and then they say the same thing. Cisgender people with precocious puberty, blah, blah, blah. I honestly don't even think cisgender actual real people should ever be put on that medicine, okay? I personally do not believe anyone should be put on that medicine. That is also a very controversial space to slow down puberty. They were doing it to slow it down, not to stop it, okay? There are different things going on here. So with that, I just wanted to show you how those trans activists are so mad because the truth is coming out. And actually that person saying, that trans activist saying, oh, like kids don't know themselves. Do you have kids? Do you actually have kids? Do you even know? Are you around kids? Do you know kids don't know shit about shit? And they learn it all from the adults. So you are the one trying to teach these kids that they know who they are at 10 and that they are trans. You're the twisted weirdo wingnuts teaching these children the most insane ideological space ever. It is going to come back on you tenfold. Hate me all you want. I don't care. I'm here to make sure all of this nonsense gets shut down because you people are nuts. Okay. So with that, I hope you really saw what I was trying to do here today. And I am sick and tired. And it is just, we have to stop this. This to me is literal child abuse. And it is in any other kind of space, we'd all be on board with, no, kids can't be in homes where they're being abused. Like to me, it's the same thing. They're being abused behind closed doors. Our parents just think they're doing the right thing for their kid because some of them are being told the wrong information. So I hope that if you know someone who has a trans kid and is kind of on the fence about not understanding it, please send them this video or please reach out to other people. Please understand that the more we educate these parents that what they're doing to their kids is not okay, the more we can help to save the future of these children. Okay, so with that, have a great rest of your day. I got to get back to baby and changing poopy diapers. Whoa, I'm going to do a whole video on this. Okay, have an awesome rest of your day. This is what happens when you F around and find out.
Some carry hate. We carry the largest trans pride flag to ever be flown in a national park and unfurled it on the side of El Cap to prove a point that trans is natural. The Trump administration and transphobes would love to have you believe that being trans is unnatural, but species that can transition sexes can be found on every continent and in every ocean on planet Earth. So call it a protest, call it a celebration. We are bringing elevation to liberation. They try to erase us from government websites and education systems and libraries. So we raise this flag higher than ever before so every trans person knows that they have people that love them in their corner. The people united will never be defeated.
Well, hate to break it to you, but you're getting defeated. This is actually what happens when you push and poke the bear constantly. You're gonna lose, okay? The people used to be okay with us. Why do you think that they're not? When you do idiotic stunts like this and act like you are so superior to everyone else, you will not erase us. Like literally constantly, we're coming after your kids. Like all the insane stuff you people say in the trans community is so ridiculous, and how you can't think it's going to come back on you tenfold is just narcissism at its finest. So before I move on with this little story, which is quite hilarious if you ask me, thanks so much for showing up again and helping support this channel and subscribing and getting the notification bell and all the things that you're doing to help me get these stories out there that who will not be erased. How come I haven't been erased? That's why the trans community comes after me, because I haven't been erased. I won't be erased because I actually live in the real world. Okay. And these people are so high on their horse. It's unbelievable to me. So if you don't know the story, it basically goes that this young woman who works for the Department of Parks climbed up the side of the mountain and hung the trans flag on El Capitan, and then she thought she was doing, and she used to go by she, but now all of a sudden she's non-binary, and then just hung the flag up there because they have a right to do that. Do you clearly you don't. Then she got fired because she is not doing her job. Her job is to be a parks ranger, manager of the park, and make sure everything is chill there, whatever they do. But it's not hanging a trans flag with your elitist sort of dominating attitude and then shocked that you got fired. Are you effing kidding me? That's not part of your job. And then that clown with the mustache and weird outfit, like a park ranger looking like a clown, who's not a park ranger, by the way. I think they're just a drag queen or another non-binary trans queer activist. This is what happens when you do dumb activism like that. So what other flags can people climb up the side of that mountain and hang? Okay, so what if you were a park ranger who was part of the KKK? Could you climb up the mountain and hang a KKK flag and be okay with that? Because if you're going to do that, then other groups of people who I don't agree with are going to be able to do the same thing. I don't know what makes you all think that you are so above and beyond the law, especially when you work for the government. So yeah, you got fired, young lady. Okay, so now it's just so unbelievable to me. So now here is the non-binary crying about it.
This is a matter of free speech.
S.J. Jocelyn, who uses they them pronouns, was fired from their job at Yosemite National Park last week.
I had the best job in the world.
Jocelyn says park leaders told them they, quote, failed to demonstrate acceptable conduct for their role in displaying a trans flag on the famous El Capitan rock formation during one of their days off in May.
I came up with the idea back in March. Just the trans community was really hurting with all of the recent kind of persecution that we've had against us from the federal government. What better meaning of a thing as hanging a huge trans flag in the most iconic feature in the park? Like, wouldn't that just be such an amazing celebration? I wasn't worried about facing repercussions at work because El Cap has a long precedent of allowing flags to be flown. So it's really been a place where people can practice free speech.
Shortly after the flag was hung, Jocelyn learned they were the subject of a criminal investigation. But when they lawyered up and declined to be questioned, that led to a mandatory administrative interview. 2 months later, they were called into a meeting.
Acting deputy superintendent shook my hand and then fired me on the spot. I asked her if she understood that I was the only one who had been fired or reprimanded for hanging flags on El Cap, even though there have been flags hung on El Cap for decades, and I didn't get answers.
Jocelyn has been a park ranger and wildlife biologist at Yosemite since 2021, and they've been a part of the community there more broadly for 16 years.
I want to fight it with everything that I have because I just want my job back, I want my life back, and I want to continue to be a part of the Yosemite community.
It's so crazy to me how this person who's worked for the park for like 4 or 5 years should know the law. It has a history of letting flags. I bet they get some kind of, they go in, they get a clearance. I bet you. And then the flags, or those flags get taken down too. Stop skirting the whole issue and pretending like you're such a victim. Also, you're not trans. Stop talking for the trans community. You're non-binary. My community, that you're non-binary. That's not trans. Okay. Plus, you don't speak for all trans people. And also, I'm not attached to that weirdo flag, okay? So what is happening to you, trans community, is you're doing it to yourself. You've literally done it. Now you're all going to victimize yourself. Wah, I got fired. You got fired because it's not your job to climb up on a ladder and hang a flag. That was not okay to be hung there. What part of the world are we living in now? I don't get it. Like, you know, that's the thing about growing up and understanding rules and regulations. Rules and regulations are in place for a reason. Or every MFer in the world would be climbing up on that mountain and hanging. It would be full of flags and full of graffiti and full of all kinds of nonsense because everyone thinks they're entitled and freedom of speech. Okay, that's government property funded by my tax dollars and your tax dollars. And I'll bet if you took a vote, majority of people will be like, no, we don't want that up there. So get a grip and you go ahead and sue. I'm just dying to see what happens. The entitlement of you all. Why don't you just take the hit, figure it out, try to figure out how to do it right the next time, and then everything will be okay. So the next insanity I have for you all.
Well, I just wanted to jump on here and make this video real quick. I've been getting a couple messages from former students of mine who are showing up at open house and realizing that I'm not there. Unfortunately, I will not be teaching for this upcoming school year. It is now illegal for me to go by my name and pronouns at work. The people that didn't want people like me to be teachers succeeded. Leaving Leonard after 4 years as a teacher, but also 4 years as a student there. At one point in my life, I had thought I was going to spend my entire career pouring into this community. And when I'm 65, 70 retiring, I could look back and kind of see the impact I had. That dream was taken away from me. My former students are watching this. I just wanted to say sorry I didn't get to say goodbye in person. But I'll never forget my time at Leonard, and I hope you have a good year.
I have the entitlement of, first off, this is a teacher who's a male to female trans person, decided they were going to I don't know what grade, but let's just say, even if it's high school, okay, but I don't think it is, was a man, presenting as a man in school as a teacher for a long time, then decided they were trans and were going to transition. Good for you. Go do that in your private space. Then thinks they're just going to walk right back into the classroom and be, instead of Mr. Smith, Mrs. Smith, and everyone's going to do the pronouns. Who do you think you people are? The entitlement. You don't get to do that. Okay, that's not your job as a teacher. No one cares about your transition or that. It's not, we're not here to validate. Kids aren't there to validate you people. What? I get so frustrated because this new trans agenda is so pathetic and so sad to me that they need validation from kids. And then you're going on TikTok and saying bye to your kids. Don't you think that's a little bit creepy? Hello, boundaries. It's why you're leaving, because no one wants to see you. Okay. So also, if you really did respect those kids and respect your own self, you would have moved yourself to another school, not let anybody know that you used to be Mr. Smith and now you're Mrs. Smith, and everything probably would have been okay, to be honest with you, because nobody would have known you're just some lady who needs to get a job as a teacher and you have a great resume, maybe. And then there you are. But no, you have to use this entitlement and this idea that you can just squeeze into spaces that you're not welcome in. This is the thing I keep telling all of you. When you transition, you're not always going to get what you want, nor are you always going to be welcome in every space. And I don't know why you all think you're entitled to every single space because you're trans. Okay, I've been doing this a long time. That's not how it works, and it probably never will. Sorry, but you are going to get erased after all the work we did so that we could at least walk the world and coexist. You don't want to coexist. You want to dominate. And it's just so obvious. Every day I see more and more of it. Every single day.
All right, so I just talked to NPR about gender conversion therapy because I went to gender conversion therapy. I went on purpose. I have an undercover camera. I wanted to document what was going on, and I will upload that footage in a different video. But what I was talking to NPR about, and what I think people really don't understand, is that they don't call it gender conversion therapy anymore. The other side got really smart. They rebranded, and it's now called gender exploratory therapy, which sounds great. Everyone should explore their gender identity with a therapist, I think, especially before undergoing medical transition. I did that with my own therapist 2 years ago before I got top surgery. It was great. But these therapists don't provide a safe space. They have a very specific agenda to dissuade people from getting medical transition and to delay it as much as possible. I'll go into that more, but if you're trans, if you have a trans friend, if you're a parent of a trans kid, make sure people know, do not go to a gender exploratory therapist. It's not real therapy.
Okay, this person is a full-on fraud journalist, okay? I've been watching this person. They went undercover into an actual real therapy, okay? And then they tried to expose the therapy as gender conversion therapy when it was just a therapist saying, are you sure? Asking the questions that every therapist should. Are you sure? Why are you in such a hurry? Let's talk about your background. What's going on in your life? All these things. And this non-binary female decides that that's called and they went in there specifically to film them, okay, and to try to expose them on NPR that this is gender conversion, like basically like gay conversion therapy. That's not what happened. That because I know the therapist. They were just trying to slow this process down. That's why they do call it exploratory. But this person is mincing words and saying that gender affirmation therapy is what you should be doing. Gender affirmation therapy is literally conversion therapy because you only have one session with a therapist and you are deemed trans. How is that not actual gay conversion therapy or conversion therapy, when the other therapist, the exploratory therapist, okay? So look at the words: affirmation, one therapy session; exploratory, many therapy sessions, because they want to make sure you're making the right point. Which one do you think is the healthiest space for a child or a person to take who is even thinking they might have gender dysphoria? Come on, I don't need to tell you which one to take. This is why these people have an agenda to transition your child at the snap of a snap. It actually, I'm exposing to you their agenda. An exploratory therapist has no desire to change somebody who has dysphoria. They want to ease you into it, which is the way it should be done, not pushed into it like this sicko journalist exposing. Like, I'm exposing you and your agenda. There should never be anything called affirmation therapy, okay? Ever. It's why we have detransitioners. It is so pathetic how these people think, now you're all getting exposed and you are getting erased, okay? Because we transsexuals are going to help erase you.
Texas has proposed a bill that would fine trans people $5,000 if they get caught going into the wrong bathroom. Under this bill, if you're a biological born male, you would have to go to the men's room. And if you're a biological born female, you would have to go to the women's bathroom. And if you get caught going into the wrong bathroom, you could get a ticket that would cost you $5,000, which seems pretty steep. What do y'all think about this? Do you agree with Texas on this or not? Let me know down in the comments.
So the bathroom bill, same thing. Of course, you guys screwed it all up. I've been using the dude's room forever. Nobody cares. Another thing you're going to erase.
The rumors are true. I'm detransitioning. After careful consideration, I realized that I no longer am transgender, so I will return to my original gender. Thank you.
So this one I wanted to bring up because, watch, I'm going to show you the second video in this, okay? Because this one is very important to me to show you.
Hi. So I'm actually like very shocked at the amount of people that really believe I'm detransitioning. No, I'm not. I'm not detransitioning. Sorry if you can hear my cat in the background, but no, I'm not detransitioning. Okay, I'm not. I really don't get why like people like actually believed it. Like, I really thought it really like came across as me being sarcastic. That's what it was. I was being sarcastic about detransitioning. So I'm not detransitioning, you guys. I'm so sorry to break it to you. I also feel like this is a good point, like a good like segue to give my opinion, my 2 cents on like detransitioning and like being a trans kid. I'm not a kid anymore, but you know, I can talk about it because I was at one point. But basically, like, everybody has the right to share their experience and everybody has the right to make whatever decision is best for them. But I have an issue when people that, and I'm not saying that you have to like transition for like, I'm not saying there's like a good reason to transition, but it really like bugs me when like people who likely were never trans to begin with are platforming on behalf of our community and like stating like things that are completely untrue. And again, this is not me having an issue with people who choose to detransition. This is me having a problem when people who detransition create this like platform and career off of just being like, yeah, so I was like on both sides, and because I was trans at one point, but now I'm cured, I can tell you that like I was brainwashed and that I was mutilated. So it's really shocking to see the amount of people that are commenting. I mean, most people were like nice about it. Like, people were saying like, do what's best for you, like you do you. But then there were like people saying like thank God you found Jesus, you know, which I really like. The sarcasm like really flew over like a lot of people's head. But it bugs me because it's like an actual, it like shows that like these people that are legit, like they're right-wing grifters, creating this like narrative about being trans that's not true.
Wow. So I wanted to show you that because this is a transitioned young boy to become a girl and now is an adult. So I'm not going to blur their face because they are an adult. And they made fun of a detransitioning, okay, which always blows my mind. Then goes on to talk about, I don't care, everyone can have their opinion, but what they're saying is not true. It's their story. How is it not true, young person? How is it not true? Shame on you. Yet this is a young person. Let's just say they're 18 years old. How dare you? Okay. If it worked out for you, everyone's super cool with it. But when it doesn't work out for somebody else, you call them right wing. Every language that can, it's all the cult language being put into these young people's brain. And what did I show you before that? I showed you the affirmation therapy model, which this kid went through, an affirmation model. And now there's no such thing as detrans. You were never trans in the first place. According to the therapist who affirmed this kid, you said they were. I can show you all the bullshit this community is doing. Yet when they make the mistake of transitioning these young people and then they become detransitioners, oh, they were never trans in the first place. Oh, it's their own fault. Oh, it's right-wing grifting BS. You people are so full of it and you're taking yourself out. No one else is doing it but you. You are spewing lies, hate. You are so mean to kids or people who detransition. It's mind-blowing to me how you expect to get respect, but you turn around and punch anyone in the face who left your little cult-like space, okay? So I am going to continue to expose the insanity of all of you people who think you are so high and mighty. I can't even believe this kid. I am just disgusted by the fact that this person can sit on there and say the things they're saying and then expect that everyone's going to be okay with trans people. You know, I'm shocked. I will be not shocked if this person detransitions in the next couple years.
A trans woman's not a woman. If I say I'm a transsexual woman, which is defining, I'm telling you, I'm a man. You can't just wake up one day and dye your hair blue and get a couple of piercings and say you're trans. That I find offensive. Trans isn't real.
That is coming from a true, real transsexual male to female who knows it's Samantha. And if you got to see the difference between the older generation of transsexuals and this new trans ideology BS. And why would her and I be against transitioning when it worked for us? Why would we be against transitioning children? Why would we be against the trans agenda? Because we can see that it is hurting people. It is not helping them the way it helped her and I move forward in the world. And we never not acknowledge our biology. I'm still a female. Samantha is still a male, period. And it's why we get respect from the world. You all trans-identified weirdos are going down, okay? And if I need help, Samantha needs to help, Tori needs to help, Blair, we all are over it. We don't want to be attached to you, and we're disgusted at the way you are doing this to children and actually indoctrinating them into this weird process. I'm going to leave you all with this, because this is how I feel.
All right, y'all, we're going to do something fun, okay? I'm going to feed this to my pigs. We'll just see what it looks like when they devoured this watermelon. Somebody's a little bit moody. You are one impatient pig.
And you know, that's how I feel. It's so good. Okay, you guys, thank you so much for watching. Thanks for subscribing to the channel. Thanks for raising my voice to the world so that we can get back to some kind of sense of reality when it comes to transsexuals. We're never going to go away, okay? But you for sure are going to erase the trans ideological nonsense with the help of the transsexuals.